Okay. So when you say two or three exams,
Correct.
um, again, is the learning curve is very similar to the step two, or is it much more difficult?
See, difficult is not a word I use on a routine basis, but I would say all the exams are structured very differently because they want to test and see if this candidate is a well-rounded candidate. For example, some of us in class were excellent at, studying, meaning we can remember, we can,
Right.
correct, we can recite, we can theorize. And there are some in the class who cannot memorize, theorize, and recite, but they can be exceptionally, skilled or gifted with their hands, right? So this exam basically is testing to see, can the candidate theorize, memorize, and recite? Can the candidate also have the same artistic skill set? Can the candidate also apply, similar, rather simple, respectable communication skills for a patient? So you have now introduced a new examination where you'll have a patient who basically is an actor, and he is introduced with a certain clinical scenario. For example, a 20-year-old male, he reports to the office, he gives you a specific complaint, and you have to go and interview this patient just like how you would routinely do this in practice, and you're asking them questions. So as healthcare providers, bedside, or what we as dentists call chairside manners, is number one, right? How courteous are you as a clinician when you approach a patient? Are you keeping in mind certain religious or certain cultural aspects of the patient who is an actor on the chair? Correct. You cannot have a one-stop shop, or rather a cookie cutter thought process and approach every patient with the same questions. So this exam is custom tailored to identify if a person is well-rounded in multiple aspects, and this dentist, this person will be a good, suitable candidate to be a licensed dentist to practice in Canada.